Welcome, everyone. We'll give everyone a couple minutes as we continue to let people in. All right, we'll go ahead and get started. I'd like to welcome everyone to our second North Dakota Prevention Professional Community of Practice, or COP. We've got some great speakers here for you today, and we're excited to have you all here. So as usual, before we begin, we'll go over a few housekeeping rules. We are recording today's meeting, so we ask that everyone mute your microphone when not speaking and refrain from posting personal questions or comments that you would not want shared on this recording. If you are having internet issues, we suggest try turning off your video camera or join by phone. If you're having trouble hearing, you can expand the audio icon located at the bottom of your screen. And you can expand the audio icon to open the audio settings. Here you can select a different speaker from the menu or adjust your volume. We also encourage you to use the emoticons under your reactions toolbar to convey emotions virtually. There will be time for a Q&A session after the presentation. You can use the chat to pose a question during this Q&A session, or use the raise your hand emoticon option under reactions to indicate that you have a question during the Q&A session. And with that, I'll turn it over to Lori to introduce our topics as well as our speakers. Lori.
Good morning, everyone. Thank you for all attending. And we're going to introduce, we have Kathy Freilich here and Senator Judy Estenson here to speak with us and to help us how to gain possible community buy-in before a tragedy can happen. Also to identify prevention advocates in our community, and also how to speak with some of our legislation to help assist get some of this out into the community. And with that, I guess I'm going to have Judy speak first. There it is. Judy, Senator Judy is a retired RN and a mother of 5. Judy and her husband Hal operate a livestock and grain farm in the rural Warwick area. She was elected to the North Dakota Senate in 2022 and served on the judiciary and state and local government committees during the 2023 session. During the interim, Judy has been a member of the Education and Judiciary Committee as well as the Employee Benefits Program Committee. And with that, Judy, we'd like to hear from you.
Well, thank you very much for having me. I'm not sure that I am by any means an expert in this field, but I will share a few things that I have learned in my role as a state senator. I recently had a chance to observe a juvenile drug court in Devil's Lake, and it was extremely interesting to me to see how juvenile justice has changed and how they're trying to be more of a preventive so that these young people who are on the wrong track can sort of be sidelined and helped along to maybe prevent future problems in the judicial system. Kathy asked me if I would do a little bit to help with this presentation, and I said, I really don't know that much about prevention, and I tried to sort of get out of it. And then I said, the only thing I know right now is about juvenile justice. So that is what I'm going to talk to you about today. North Dakota drug courts joins nearly 4,000 drug courts nationwide in celebrating Drug Court Month. Drug courts are now the most successful justice program for reducing addiction, crime, and recidivism while saving taxpayer dollars. North Dakota's drug court graduates entered the program addicted to drugs and often facing incarceration. But because of the combination of accountability and treatment they received in drug court, they are now going back to school, reuniting with their families, finding employment, and paying taxes. North Dakota has 6 juvenile drug courts and 6 adult drug courts. The first courts opened their doors in May of 2000 in Fargo and Grand Forks and were juvenile drug courts. Drug courts help keep our roads safe from drunk drivers, intervene before our youth embark on debilitating life of drug abuse and crime, and give the participants the tools they need to stay clean. The purpose of juvenile drug courts is to help the juvenile break the habit of addiction and breaking the law through intensive treatment, supervision, and a system of incentives and sanctions to motivate positive behavior. Instead of putting the juvenile into detention, the youth is given the tools they need to understand their addiction, to learn life skills, and to make positive choices. Upon successful completion of the program, the juvenile may have their records cleared. More importantly, they have the tools they need to go into the world as a productive individual who can make good decisions. How do these kids show up here in drug court? They're usually referred by the judges and the prosecuting attorneys. Parents are required to participate. Some courts have parent-specific classes. Grand Forks just started a monthly parent group. As you can imagine, the parents of these kids often have addiction issues of their own, as well as poor parenting skills. This gives us a way to try to improve the homes as well as help the kids. When I visited drug court in Devil's Lake, what I found interesting is the number of people involved in actually what I would say looks like parenting of this child, of this juvenile. It is schools and social services and the judges, and it's almost like they have all these people rooting with them to try to teach them these skills that they have not possibly learned in their home life. It's a beautiful thing. And even though they talk about the costs being high, we all know that there is no price on turning a child's life around into a positive direction and being free from whatever drug that they are abusing. Juvenile courts are located in Grand Forks, Fargo, Stutzman, Barnes, Bismarck, Devil's Lake, and Minot and Williston. The program focuses on kids aged 13 to 17 who are high risk, high need. Risk is the likelihood of continued or future legal problems. Need looks at the other elements that a kid has, such as past trauma, poor home life, history of family addiction. The program is intensive and combines drug addiction treatment, mental health counseling, drug testing, regular parole visits, weekly court attendance, and focus on developing basic life skills. Each participant gets each of these elements. Along with learning how to deal with their addictions, these kids learn about managing a banking account, applying for jobs, and getting their GEDs. These programs are much more than just court. North Dakota's juvenile drug courts have a success rate slightly over the national average, but the real success is in the stories. We have kids who are sober, committed parents because of drug court. Many are holding down jobs and living in apartments because of the skills they learned. The stories are as varied as the participants. It's a beautiful thing, again, to just turn around and change someone's life, not just for theirs, but for the next generations, because many of these kids come from generations of abuse, abuse of drugs, abuse of alcohol. So with that, I would conclude. If there's any questions, I guess I'd be glad to answer them at this time.
So we'll open up the floor to take a couple of questions before we proceed with Kathy's presentation. If you asked, excuse me, if you have any questions, we ask that you utilize the emoticon and raise your hand so that we can call on you.
Go ahead, Chelsea.
My question is, this came up in our local community coalition conversation about drug court, and in Williams County, we do not have a drug court. Do you know, like, what are some simple steps to start to create a drug court in your area, or what does that look like for creation?
You know, I'm not really sure about creation. I do know how I could give you a contact information of the person that actually is in charge of that. And I would think that that question could go to her. Her name is Jessica Throlson. And I can even, yeah, I can give you her email address, or how about her phone number? And you could contact her and see what you could do to try to encourage something like that in your area.
Thank you so much.
It's Jess Throlson, Throlson, and her phone number is 701-328-2198. She's the program manager.
Any other questions? Great, Judy, thank you for that presentation. We'll turn it over to Lori to introduce our next presenter.
Okay, again, thank you very much, Judy. And Kathy, thank you for coming. Kathy Freilich is a representative of District 15. Kathy and I have worked together for many, many years. She is a representative. She currently works at the North Dakota School for the Deaf in the Adult Outreach Program. She has a bachelor's degree in human resources with a concentration in social services. She has prior experience in long-term care, childcare, and development disabilities. She was elected in 2022 and sits on the Health and Human Service Committees. She and her husband farm northeast of Devil's Lake. They have 3 daughters and 5 grandchildren. Kathy also sits, I know, on our coalition team here in Devil's Lake also. And with that, I will turn it over to you, Kathy.
Thank you, Lori. Thank you for all those kind things that you said, even though we worked together for 100 years. That's a good sign.
Okay, we're old.
Yeah. So thank you for having me here. And again, I'm a new legislator, just elected in 2022. So I had my first session, and I wanted to give you a brief update on what we went through that session in 2023, and a couple of the bills that we looked at that talked about alcoholism and drug abuse, and then mention what we are talking about during the interim, and then what we are looking at going forward. So first, as Judy said, I just want to say too that I hope you are not looking to our legislators as prevention experts. we are a citizen legislature, so we come to the session with our own backgrounds and life experiences, but we're there to make decisions for the best of North Dakota as much as possible. And so a lot of times we are not the ones bringing forward the bills. In fact, the two bills I'm going to talk about in the 2023 session were brought forward by the Department of Health. So first, I put my glasses on here. I've got a couple things that I wanted to read. There was Senate Bill 2086, and it was introduced by the department, and the department licenses addiction counseling and certifies instructors to provide treatment for those youth that are at risk. And so what they wanted to do was separate that out. And so that if you were being certified to treat youth, you didn't have to be working in a licensed counseling program. And the idea was to try to treat people before they had that diagnosis of addiction. So this might be your youth that might have a minor in possession, a DUI, or a possession of a marijuana charge, but they don't have that classification or diagnosis of addiction. And so these people could still become certified and provide services to them, even though they're not working in an addiction counseling setting. And so the idea was just to reduce some red tape, regulatory burden. And for example, you could have, I would imagine anybody on this call could go through the training and then provide services to these youth that are at risk, rather than waiting for them to be treated further along when they actually have a full-blown addiction. So that actually passed our committee 12-0, and it passed the House 92-0. And I only mention that because it shows you the very strong motivation of the legislature when it comes to youth and children at risk. So they do want to do something. They're going to try to reduce regulations as much as possible while still providing good services to our youth. And that's always the real balance there, is we want to reduce regulation, but we want to make sure that our citizens are safe as well. So then there was House Bill 1050, and that was also introduced by the department, and it asked for two main changes. The first change was just a terminology change. Instead of using the word substance abuse, they wanted to use the word substance use disorder. And it seems like a minor change, but they just wanted to change the terminology, and the idea is to change it throughout all the Century Code so it's uniform. Then they wanted the ability to notify providers. Let's say you had a counseling service and they are doing the regulation, the licensing and everything, and they wanted to either suspend that license or revoke that license. They wanted the ability to be able to send that notification out by email rather than by registered mail. And we had a lot of talk in our Human Services Committee that we didn't want that to go out just by email. Yes, it might be faster, but there's really no way to tell if somebody received an email. There's no law saying that these providers needed to have email. So what we changed or amended their bill to say would be that they have to, they can do the email, but they have to follow up with a registered mail as well if they're planning to revoke or suspend a license. And we thought that was a good change. Then we went further looking at that part of the Century Code when we had it in front of us, and what they did with detox centers. It was under, detox centers used to be under the hospital code, and they did take that out. Not that they took out some of the regulations of what a detox center has to have, but they no longer have to be within a hospital. So you can provide those services in a different kind of facility. And we just thought that would open up the ability to provide services in different communities that maybe don't have access to those hospital detox. And we have found, even in our community, and Lori can tell you, that we have a problem not having a detox center or a social detox center in our area as well. And that is a problem with a lot of areas in North Dakota. So we were just hoping to reduce some of the regulatory burden on that part too. And that did pass our committee 14-0 and passed our House of Representatives 91-0. So again, very strong desire to do something about services and prevention and making sure we could get those services out to the communities of North Dakota. So those are only two bills that we had. There was many bills that came through both judiciary and human services during the 2023 session, but I just wanted to mention those two. We will look later at the legislative website, and I can show you where all the bills are listed and how to find them. But now going into the interim, now the interim is that period between sessions. And legislators are only in session for 4 months out of every 2 years. And it's kind of funny because even now I see people on the streets and they'll say, "Oh, Kathy, you're back from Bismarck." And I was like, well, I was back last year in 2020, in 2023, I was back in April. So, and we don't go back now until January of 2025. But during the interim, we are still very busy. We get on committees, and I'm on two. I'm on the Health Services Committee and the Human Services Committee during the interim. And what we do during the interim is we are getting reports from studies. A lot of times during this session, we might pass a study and we want the department to provide us information during the interim so we can see going forward if there's any new legislation that is required or needed for the 2025 session. There's some studies that are and reports that are built into the code that they have to provide to us every single interim session, and some are just one-time studies. But one report that we got, and I believe this came out last August, and I can try to link it in the chat later, but it was from the department, and it was all based on unintentional drug overdose deaths. And it was really eye-opening, really interesting. And some of the things that we learned on there was that unintentional overdose deaths are on the rise. And it listed that there was, in the age category between 10 and 19 years old, we had 6 unintentional deaths. And then, and maybe that doesn't sound like a lot. The age between 30 and 39 was the biggest category for those deaths. But when you think about our children, 6 is still a lot. And we also received a map that indicates that the 3 counties where they were the highest was Benson, Montreal, and Sioux County. And the ratio was really, really incredible. I mean, it like I said, it was eye-opening that they were so much higher in those counties. And the overdose, and what's interesting is the overdose deaths overall for all ages for American Indians is 8.42 per 10,000 people, compared to 1.2 per 10,000 people of the white population. And so that's a huge difference. And so that's where a lot of the services are concentrated. Most common combination in these overdose deaths was a mixture of opioids and amphetamines in the blood system. And we also heard fentanyl deaths are on the rise, and we've had 9 xylazine or tranq deaths in North Dakota. Yesterday, I was at a meeting, and our Attorney General, Drew Wrigley, was giving a report indicating the movement of fentanyl through the country. And he was talking about how this fentanyl comes overseas and ends up off of the coast of Southern California, and they're on a ship, and they use pharmaceutical presses, just like you would see at a Pfizer or Johnson & Johnson, where they're pressing this fentanyl into tablets. And then from there, the tablets make their way into the southern border, and they're coming up through, he said, Detroit, Colorado, sometimes from Minneapolis, but the cities, but most of it's Detroit and Colorado, and they're coming into our reservations. And so and his concern there is that we really have a hard time tracking that because of and there's such a low incident or low number of police officers or tribal police officers on the reservations. They are also understaffed. And so we need to try to work with them and try to figure out how to stop that flow of fentanyl into our reservations and then out into our communities. It's been a big concern. So what I found through the interim committees hearing this last year is that we can't be thinking about our problems in silos. You know, we have a lot of problems that are affecting youth. We have our substance use, we have our mental health use, and we have our behavioral crisis concerns. And I think that going forward, we need to overlap our services so that we're treating all of this all at the same time, because it sure seems like these problems overlap each other and in our communities. And so if you find somebody who is having a problem with substance use, they probably have a problem with mental health or behavioral health as well. And so we have to address all of these things, hopefully at the same time through our services. And so, we have been looking through a lot of things. And another thing I learned over the interim is that we actually do have a lot of programs addressing these things in North Dakota. I was a little sad when I looked at the maps that they were providing to us that in our Region 3, we're kind of left out of a lot of these kinds of programs. And so I was disappointed to see that, but we do have a lot across the state. And I'll just mention a couple here. We've increased the telehealth services, you know, with our shortage of providers across the state in mental health, behavioral health, we've gone to a lot of telehealth services. And so we have to look at that for prevention of substance use as well. And then we have 8 school-based mental health service plans across the state. We have Project Heal, which is through Sanford, and it's for trauma care for Native American youth. We have Be Heard, which is a mental health training for all teachers and staff in school. We have Be Hero, which is behavioral health school grants, and that's for training and resources in school for intervention and identification. We have Cognito, which is a digital learning to help build critical life skills, and that's available to all North Dakota school personnel and 6th and 12th grade students. So the students can get into that too. We also have friend-to-friend youth modules for those 6th to 12th graders. And we have voluntary treatment programs, residential addiction services for youth. We've also looked at Medicaid. They have a waiver. It's called the 1915I waiver. And the idea for that is that we could help with home and community-based services. So expands that a little bit so we can get help into homes when needed. There was also a federal grant that was brought down at the state level, and it was called the Systems of Care Grant, and it was awarded in 2 regions, 3 and 7, and 3 is my region, so it covers from the Spirit Lake Nation through Devil's Lake, and then quite a bit distance up north of Devil's Lake as well. And so we look forward to down the road to see how that grant develops programs in our region. And the hope is that if we can develop wraparound services for youth and children that are in emotional distress. So the idea is for wraparound services. We want to meet all their needs in the community. There was a lot of talk during this session about institutionalization. And so we do have services in our bigger cities, Fargo, Grand Forks, Bismarck, But our goal is to keep our kids in our community. So yes, we can send kids away and provide services in Fargo, but we want them to stay near their support system. So there was a little bit of a push to expand the number of beds in those cities. But there was quite a long time ago, they had the Olmsted decision, and that was to reduce institutionalization. And so we kind of fought against increasing those numbers. Right now, they can only have 16 beds. And we did fight against increasing those numbers with the hope that we would have services in our communities. But the problem is, we're still fighting this problem, after the pandemic with the workforce shortage and getting people into these types of jobs. There are funds out there to encourage people to go into mental health and behavioral health types of positions, whether it's through our medical facilities. They're providing funds to help maybe a nurse who wants to now go into mental health. They can go get that training, and it's paid for through the private company. But we also have a lot of different incentives through the state that we're providing. And right now, we just need the people. We need people to come forward who are willing to get experience and training in those situations. I think my takeaway from all of this as a new legislator was really that the state can't come in and save the day for everybody. And we, as our communities, have to be neighbors helping neighbors and figuring out what's going to work best in our community. And I'm not saying that the state won't pay for those services. I think the state has a lot of money, and that those funds would be available to support services. But we need people like you, people from the community, to tell us what they need. And also, not just your legislators, but also your community, for example, like your human resources people at the Human Services Center, your social services facilities. Hopefully they listen and they send that information back to the department, and they can develop new plans. But that being said, I do want to move on to the next slide and talk about how to contact and how to talk to your legislators to get the most impact. And I don't know how many people are familiar with the North Dakota website for the legislature. This one here is if you just click on the northdakotalegis.gov page, this is what will show up. And so when I go, and I was on here before I became a legislator, and I've used this site all the time. So I just kind of wanted to walk you through it and explain how this can be used when you're thinking of advocating for your clients. So if you go on this first page, you'll see there's an arrow that says Legislative Assembly. And then if you go to the next page, you'll be asked to choose the year. And you could see on the top, I just chose the 68th Legislative Assembly. That was 2023. And you can scroll down, and on the left-hand side, you can go to members, and you could see your House and Senate. You could even go by district. So if you're not even sure who your legislators are, you can click on that left-hand side where it says by district and find out who your legislators are. But when I brought you to this slide, I wanted to show you that major topics index. So I have an arrow right there to that. And if you click on that, we'll go to the next slide. You'll see these are all, I just clicked on alcohol, and these are all of the different bills that we saw that were related to alcohol. I think there's one in there that says you won't lose your license if you're driving on or riding on a horse intoxicated. Not that you can ride on a horse intoxicated, but you won't lose your driver's license anymore. So we had some really interesting bills go through, and not all of these bills passed. In fact, I wonder if the majority of them didn't pass, but there was a couple on there that I've already highlighted, 1050 and 2086. Now, you don't always have to go through this part to find the bill. For example, that second arrow on the top says enter bill number. So once I know the bill that I'm looking for, now every time I go in and try to track a bill, I can just enter it into where it says enter bill number and the year. Now, what I would recommend to stay involved and learn the process is when this first comes out in the next session in January, I would go to that major topic index, find a few bills that you want to follow, and then have the number, and then just keep going back and put them into the enter bill section and just follow them along. If you go to the next slide. So you can see, I've just clicked on the bill, House Bill 1277, just to see what it would look like. And you can see the arrows, so it can tell you that the sponsors, and there's the representatives and the senators' names that sponsored this bill. Then you can click on versions. That is really important, because sometimes what we have found as legislators is you click on the version, and you want to go to the one on the bottom, because the one on the bottom is the most current. Sometimes I would get emails about a bill and we already amended a portion out of it, so it wasn't even a concern anymore. So make sure you're always looking at the most recent version of a bill. Then you can also go to the video section, and now you can watch all the hearings. You can watch your legislators get up and speak on the House floor. You can hear every single part that bill went through and who spoke on it, and even what the votes were. So you can find out how your legislators voted on a certain bill. I was doing this even before I became a legislator, trying to track bills, but even as a legislator, I use this site all the time. So when you go to the legislature, you have the first, three sections of the legislative session. The first session, all the bills are coming into your committee and you're reviewing them, you're amending them. Then they go to the House floor and they pass them or they do not pass them. And the Senate is doing the same thing. They have bills that are introduced in committee, they amend them, they pass them in committee or give a recommendation in committee, then they go to the Senate floor and they pass or fail. Then you have the crossover, where now all the House bills go to the Senate side and all the Senate bills go to the House side. That's the crossover. Now, when I'm in the second session of the session, what I do is I go on these videos and I'm listening to the bills that are the ones that I see are coming up on my committee in the morning. I'm watching the video of the Senate side before they even come to my committee, so I can find out what those questions were, and if I have more questions or if I agreed or disagreed. I think the more questions that are asked, the more you learn about a bill. So that's how I use the website as well. It's a really good tool, and we're on camera every time we talk, so you can track down anything you want to see about a legislator and what their opinion is on a bill. And then the next part is testimony. So you want to provide testimony to a bill. So if you clicked on that slide that said testimony, it'll bring you to a part where you can see what the testimony is. But if you are wanting to provide testimony, you can actually click on a section there and add to it. So if you see a bill that you're really interested in and you just want to let the legislators know how this impacts my clients, my community, go ahead and you can write it down and enter it. And I'm going to tell you that the best testimony is the testimony that is in person. I know that's not possible for everybody. We live 3 hours away from Bismarck, and it's not easy to drive just to go and talk for 15 minutes. So I get that. So if you can provide testimony at all, provide it in writing on that site, and then it comes to us. We will see it on our laptops and the software that they give us, and we read through all of that. This was just on the legislative website, and it talks about how to provide testimony. So you can go on that as well and just read through what the best way to do that is. Okay, you want to go forward? Go to the next slide, please. Okay. So how to contact your legislators. Know who your legislators are, and they are the most likely ones to listen to your concerns. And I would always start your email off with, "Hi, my name is Sarah. I am one of your constituents." if you're a legislator and you get that email, that's the one you're going to listen to the most, because you want to focus on the constituents in your district. So I'm a constituent of yours, and I'm from this and such town. You can email us or call us. All of our information is on that legislative website. Make your email personable. For example, don't use, I mean, we've probably all seen those sites that come across on our Facebook or email that said, hey, contact your legislator, and you basically are just putting in your email and pushing send, and you get a form email sent to you. Those are good. I mean, as far as you see the bulk of what's there, so you can see a bulk of how much you're getting into your email box on a certain situation or a certain bill. But it's so much better if you make it personal. If you tell us exactly how this bill is going to impact you or your community. Make sure your information is up to date and accurate. For example, I was getting emails sometimes for a bill that already went out of our committee and was over to the Senate side. And I would try to take the time and say, hey, this is already passed the House. Here's the people in your conference or your committee. Maybe the bill is going over to judiciary in the Senate side. Here's all the people listed on the judiciary committee. Contact them instead, because I can't do anything about it anymore at that point. So make sure your information is up to date and accurate. Don't rely on social media for legislative updates, because usually they're so far behind on the bills. Sometimes we're seeing posts that the bill is long gone before that post saw you and you responded to it. Be respectful. It goes a long way. We actually had a legislator who told me that she got an email telling her that they hoped all of her children died of cancer. And I can't even remember what the bill is from, but those kind of bills or those kind of emails are not going to get any positive reaction from your legislator. So let them know your concerns and how the legislation will impact you or your clients, and be specific where possible. Now, that's when we're contacting your own legislator. There are times when you want to contact either the whole body of legislators, and that's possible. But my other recommendation is to contact the people that are on the committee. I'm on Health and Human Services Committee. I'm also on the Transportation Committee. And Judy was on the Judiciary Committee. So if you had a bill and you knew it was in this committee and they were going to have a hearing on it coming up, I would contact everybody on that committee and say, hey, this is what we are interested in, and this is why. So I would sometimes you just talk to your legislator, sometimes you talk to the whole committee, and sometimes you have to send something out to the whole legislative body. So it depends on what you're doing. And again, we're citizen legislators. We need your input. We are not experts on every single subject there. We are down there in Bismarck for 4 months, reading, and trying to do the best we can to get a good grasp of each subject. But it is so much better if we can hear from you and what you need us to do down there. So, and I think next slide. So if there's any questions, I'm open to questions. And I also put on our email addresses there, so that if you don't want to ask a question today, you can feel free to email Judy or I, and we will get back to you as soon as possible. Just to give you a heads up, during the session, sometimes we're probably getting 100 emails a day. And if we are in session, sometimes there's 50 emails in an hour. So it's a lot of emails to get through. And I think you should expect your legislator to get back to you if you're contacting them as a constituent. And if they aren't, I would call them out on that, because that is what we should be doing. Any questions?
Kathy, this is Lori. I do have a question. For instance, if we wanted to make it a state law for North Dakota, where all counties had to have the bars attend responsible beverage server training, which we do have here in Ramsey County, but we would like to get it throughout North Dakota. Who would we first reach out to?
I would say you would reach out to your legislator. And then what happens is your legislator would then contact legislative council. So like I said, your legislators aren't experts and we're not lawyers, but we do have a staff in Bismarck, which called legislative council, and they will draft whatever we need. So if it comes to your legislator and your legislator is on board to get this drafted, they would send the information to legislative council. They would draft the bill for you so that it shows up in the right spot in the century code, and they will look through and make sure everything is done correctly as per law. And then your legislator would be looking for other legislators to sign on. So for example, if I brought a bill forward myself, it wouldn't have as much weight as it would if I could get 10 other legislators, both House and Senate, to try to sign on it as well. Then when that bill comes to the session, and then the important part comes for you guys is to come forward and provide testimony. And if you could provide testimony as an agency, that's great. But if you could find people who will come and testify to the committee and show how that is affecting their life, that is even more important. So that's what I would do. I would contact your legislator, ask them for this idea, ask if they're interested, they'll go forward with a draft. And if they're not interested, I would reach out to a different legislator.
Perfect. Thank you very much.
Very good information. I just have a couple questions too. So my name is Tom Volk. I work for the Behavioral Health Division. And one of the things that we really promote is policy change and law change and prevention to help create that environment, to help keep the kids and families safe in North Dakota. And knowing our environment in North Dakota, which is very much about, less government, reduction of regulation and stuff like that, what would our angle be to try to get some of these laws and policies passed? Like, for example, one of the most effective prevention strategies that we have is the increase in price of alcohol or tobacco products, most likely through a user fee or a tax. And boy, that word tax in North Dakota, you can't really say. And we haven't, and it shows, we haven't changed taxes on alcohol in over 50 years. And we haven't changed taxes on tobacco in over 20. And it's impacting the rates of consumption in North Dakota. Like, for example, we're still ranking in the top 5 when it comes to underage drinking and even adult binge drinking and things like that. So knowing our atmosphere, what could some of our angles be for getting some of these effective policies passed, which really could make an impact on the consumption rates and even the consequences that we're seeing in North Dakota? Is like, because thinking back to maybe a policy that you thought you would never buy into, was there something or an angle that came to you guys that was like, okay, they used the right angle, they gave me the information, and it changed your mind? Could you give us some insight on something like that?
There were quite a few bills that came through that when I started listening to somebody talk, I thought, wow, that seems like a really good idea. I'm on board with this idea. I think it's great. And then you'd start hearing other sides of it, and then I would change my mind. And so you really have to, I learned really early on not to tell anybody what my vote was going to be, because I realized I couldn't decide that myself until I had all the information. One thing that would be interesting, and they do it a lot in the session, are resolutions. And so you might do a resolution saying that North Dakota recognizes that they have a problem and the legislature is committed to moving forward to having less underage drinking. A resolution usually looks at the problem and then states that, and then just basically says that the legislature will do or will pass laws or will do this because we know we want to prevent underage drinking. And a resolution isn't a law. So it's really tough to say that there's any value to it, but it does put the mindset into the legislators to say, hey, yeah, remember we passed that resolution? This next bill going forward is right along with that. This bill will prevent underage drinking. This bill will prevent your 13-year-old from obtaining fentanyl on the streets. So if we have the resolution, maybe that would hold legislators accountable to passing these bills. I also think that you're right, tax is a tough word in North Dakota. And it's hard to say that we need more tax income when the state has so much money right now. But if you do want to increase the cost or sale of alcohol, then I would say, what are you going to use the money for? And make sure that money is earmarked for a prevention type of program, so that it all goes into a pocket to help prevent underage drinking, so that there's a goal at the end of the tax. I think a tax one is going to be a hard one. And especially, I'm even thinking about even our agricultural environment here, and you put a tax on beer and we've got all these barley farmers that are going to go nuts. So I get that. A tax would be hard. But there are other bills that could be passed, like Lori said, with the training, because we do have a problem with people being served underage too. And actually, I know that one of the biggest problems we have is our parents acknowledging that their children are drinking and saying, drink at home. And their thought is their heart might be in the right place, where they want to make sure they're not getting into a car and driving and getting a DUI, or killing themselves or killing somebody else. And yet that thought process goes into that child and thinks, oh, there's nothing wrong with what I'm doing then, as long as I'm staying home. And yet their friends come over. Are their friends staying over? I mean, there's so many things to think about. And I know Lori and I have talked about this before, and sometimes we have to change the mindset of the parents. And I know in even our community, we try to do a few more things to try to give our youth something more to do other than alcohol. I know alcohol consumption, drug consumption is really high in North Dakota, and people always say, well, there's nothing else to do. It's so cold in North Dakota. What do you do? And that's a tough stigma to get out of, and try to find other activities for our children. So, and you know, it all runs into the other problems. You go from the substance use to the mental health and behavioral. Now all of a sudden we have a suicide issue. So it is all wrapped up together. I wish I had better answers sometimes.
No, it's tough. Like, we even talk about, like, our state does not have a regulatory board over alcohol and tobacco. So it's kind of, some of the regulation and oversight is kind of tasked between the AG's office and the tax commissioner. But then there is no real state oversight or state, like, law enforcement that would, check in on our alcohol retailers or tobacco retailers. And in a lot of other states, they have alcohol and tobacco review boards, where they go over the licenses and things like that, and they try to get consistent enforcement, because there's like places in Bismarck now that sell alcohol in the gas stations, of course. And by law, it says that there has to be a partition so that the kids can't enter. Well, in this one that I'm thinking of, you can walk literally right up to the cases of beer. They made the partition out of beer boxes, and like cases of beer. So it's like, that's not the point. The point is so that the kids can't grab the alcohol when the clerk is not looking. And it's like,
and I've seen one where it's just a swinging door and that's it. Yep. And a lot of times what we hear in the legislature too is there's this big drive on local control. But I found that they only say that when they really want it not to be their problem. They want to push it back on the counties and the communities. So sometimes they'll take all the local control away, and sometimes they want to push it all back. And there doesn't seem to be any real sense to when they're going to do that. So I think I stood up on the House floor for one of the bills and I said, I'm all for local control, and I think that's great. But when it comes to our children, we have to protect them, and that has to take priority.
That's a good angle. I know you said that earlier too, like, make it about protecting the youth and and making it about a youth issue and things like that, which we can obviously show through our data that we definitely have a youth issue when it comes to alcohol. So yeah, that's a really good angle. So.
Yeah, and I think there is a concern too, when I was with the Attorney General yesterday and he was giving us a report. One of the things that was concerning was in our court system and how much, they would say, and okay, now I'm not talking about juveniles anymore, but you could have somebody who gets a minor infraction due to an alcohol or drug related offense. They really can't do much about it because we don't even have any room in our jails. And our prisons are full. And so if you put your foot down and say, okay, we're gonna send this kid to jail for a month and maybe they'll learn their lesson the hard way kind of thing and do tough love, whatever that is. But then you're gonna have to, on the other hand, let out a pretty hardened criminal after serving less than half of their sentence. So we have a problem with our justice system too, and our juvenile justice system as well, trying to figure out what's the best thing for these kids. We don't want to put kids in jail with hardened criminals, but we have to have consequences as well.
Yeah, we have some of those same discussions because it doesn't necessarily have to be jail time. Kids really value their, and this is through research, they value their driver's license and they value their time. So if we had a really good, robust community
Maybe
service
they should
program,
take their phones away.
exactly right. Like if we had a really good system, like a community service system, for example, where we made these kids work on the weekends, like painting parks and mowing grass, for the community
Right.
members, I think that would be great. But yeah, I don't know how you'd even get that passed at a state level. But yeah.
But
you're
if you
right.
have
Has to
if
be
you have
consequences.
ideas, like I said, contact your legislators, and they don't have all the ideas, but they can turn it into legislative council and see if they can get anybody else on board. But the important part then is going to be getting down there and providing the testimony. It can't be just the legislator that's bringing it forward. It has to have community input saying this is what we need and why.
Yeah, good point.
Any other questions?
When do the laws first start becoming available and stuff like that? Do you know? Because I know that there's conversations about laws ahead of time, but do you know when they start posting those, getting those up?
No, it's crazy that you asked that. So are you talking about when the bills come forward?
Yeah, even when they start drafting bills, is
Okay,
there?
when they start drafting bills, we actually are able to start sending them already. I've actually have one bill drafted already and ready to go. I would have to then go and push submit down the road. So I haven't submitted the bill, but I do have it drafted. And so a lot of legislators are out there drafting bills right now, but you wouldn't probably see them until, I don't know that you're going to see them until December. Our legislative council says, hey, if you have any ideas, we want to hear them early. There is a cutoff in January where we can't introduce a bill after that because we got to get it through the process. But I don't think you would see it. I mean, we can't see other legislators' bills until they push submit. And that's why sometimes you get a lot of overlap. You might have 3 legislators having the same idea and they all submit a bill. And then it's kind of funny because you'll get to a session and 2 bills are killed and 1 is passed. And all of a sudden the media will go crazy and say, oh, the House just voted no against a bill for saving puppies or something like that. And here we had 2 other bills ready to go. So sometimes the social media gets a little crazy too. But when we go to session, that's really interesting. So a lot of times we're in session about 1 o'clock in the afternoon, 2 o'clock, somewhere in there. And when a bill comes in there and it didn't go through my committee, remember I said I'm on Human Services and Transportation, but let's say it came through the Judiciary Committee in the House, I only get that bill the night before on my iPad at 8 o'clock usually. So I have from 8 o'clock the night before until the next day at 2 o'clock to try to do my due diligence and read that bill and try to figure out what it's saying and what the impact is. Sometimes we have a little bit more time, but very quickly you learn to use all your tools, whether it's watching the videos or reading through the testimony or talking to colleagues to try to figure this out. Like I said, you have from 8 o'clock at night till 2 o'clock the next day maybe, but you're in your committee hearing in the morning. So there's not a lot of time. So a lot of times I'm reading up bills. I'm listening to videos as I'm getting ready in the morning, and I'm reading bills through the lunch hour, trying to get ready for the afternoon. So we don't have much time to even see the bills.
So yeah, so then there really is no way to see those drafts or anything like that, or
The
even know what's
drafts,
going
no,
on.
they
Yeah,
won't, not until they're posted on that website that I put on the screen.
perfect.
You won't see them. In fact, I won't see them until then either.
Any other questions for Kathy?
Hi, Kathy. Thanks for being here and talking with us today. Just a quick question. Do you appreciate when organizations or constituents come and talk to you before the legislative session about maybe their possible priorities?
Yes, we actually get invited to a lot of just quick meetings to talk about what, for example, I don't know, Farm Bureau might call us and say, hey, Kathy, would you sit down with us and have a quick meeting? These are the bills that we have going forward. We'd like to talk to you about them. Or it could be an oil company, or it could be this, or it could be your county commissioners want to have a visit with you. And that's really common, and it's really helpful. Earlier is better. It gets kind of crazy that month before the session starts. So the earlier the better would be great. And even if we can't meet in person, if we met by Zoom, that would be something too. And I would always contact your legislators. So whichever district you're in, contact those legislators. And even if you can't meet, if there's no time to meet, send them emails and say, hey, this is what our agency is looking at right now. These are our concerns. This is what we know is coming through the line as far as legislative bills are coming in the session, and this is our opinion on them. I think those are good ideas. And as legislator, you're not going to agree with all the input that you're getting, but it certainly helps to hear things. One time I went to door knocking during a campaign, and a gentleman asked me what I knew about ANS. And I was like, ANS, aquatic nuisance species. and we had a very lengthy conversation about this. And you know what? A bill came up in the session, and it was like light bulb. Oh yeah, this is what this gentleman was talking about. And so it's good to have that information in our head when we're going into the session. So I would say, yes, absolutely reach out to your legislators. I know it's kind of crunch time in that November, December area where people are trying to reach out to them and try to meet with them, but I would still do it anyway.
Any other questions?
Well, thank you for having me and talking. And like I said, even if I'm not your legislator, reach out to me anytime. I go through my emails every day, so I'll get back to you.
Kathy, thank you for being here and providing us with useful information for sure. Thank everyone for participating.
Can I do a quick shout out too first? I had a friend,
Sure.
my daughter said her friend is on here, Jordan. So hi, Jordan. Good to see you on the call.
Oh, hey, Kathy. It was awesome. Thank you for all the great information. Yeah, I was texting Rachel, like, your mom is so helpful. She's a great person to have on these behavioral health committees. So thank you so much.
Thank you. Yeah. Thank you for saying that to my daughter too. That always helps.
Yeah.
Thank you for having me.
Thank you.
Bye-bye.
Again, thank you everyone for participating. Please take a moment to complete a brief evaluation that will help us improve the COP and plan for the next topics for our meetings. I've posted the link in the chat. You can also utilize the QR code as well. That being said, Tom, I'll open up the floor to you if you have anything you'd like to say.
Yeah, I just want to say thanks everyone for being here. And it's always great to hear a legislator's point of view during these things that we're trying to work on. So it was just great. And I just want to say thanks for your service, you guys. I know it's difficult to be a public servant nowadays with social media and everything else. So I just want to say thank you for what you do for making North Dakota what it is. So that's all I got. Thanks, you guys.
Yep, thanks everyone for attending. Please take a moment to complete the evaluation before leaving.
And I was going to put that link in there, but it didn't let me. So I'll send it to Lori, and if there's a way for her to send out that study link that they did on unintentional drug overdose deaths, I'll get that to Lori Stevenson and she can get it out.
Okay, thank you.
Okay, bye-bye.
All right. Thanks again, you guys.
Thanks, everyone.
Bye-bye.
Bye-bye.